Welcome, and thank you for joining the Community Care Plan Provider webinar on telemedicine. What is telemedicine? It allows healthcare professionals to evaluate, diagnose, and treat patients without being physically there. Uses telecommunications technology to make contact with the patient. And the utilization of smart devices allows the delivery of remote health care to patients in their homes, workplaces, and assisted living facilities. Benefits of telemedicine. For patients, no travel expenses or time. Privacy. No exposure to other potentially contagious patients and less time away from work. For providers, increased revenue, better patient follow-up, improved health outcomes, and fewer missed appointments and cancellations. Health Insurance Portability and Accountability Act. Telemedicine is subject to HIPAA regulations because patient data will be transmitted. Please be aware that Skype and FaceTime does not meet HIPAA standards. Providers must choose a secure data encryption application in order to be in compliance and to protect patient data. CCP Telemedicine Guidelines. Services provided under Florida Medicaid must be performed by a licensed practitioner within their scope of practice. Services must involve the use of interactive telecommunications equipment, including audio and video, permitting two-way, real-time communication. Telephone conversations, chart review, electronic mail messages, or facsimile transmissions are not considered telemedicine. CCP enrollees will receive a welcome packet and an onboarding call that will advise they are eligible for telemedicine services. CCP's website also has information regarding telemedicine services available to our enrollees and provides instructions on how they can access these services from anywhere. Covered services. Providers may use telemedicine within the standards specified in ACA's Medicaid Services Coverage and Limitation Handbooks for the following services: practitioner services, behavioral health services, and dental services. Services rendered through telemedicine will be fulfilled to the same extent as those face-to-face services. We provide our members with a choice to access services through face-to-face or telemedicine encounter, and their selection must be documented in the member's medical record. Provider telemedicine requirements. Must be appropriately licensed in the state of Florida. The equipment used must meet the definition of telecommunication equipment defined in the ACA contract. Must be currently contracted and credentialed through CCP's MMA network. And finally, will be required to submit a CCP attestation and a checklist process that will be implemented by CCP. If you are not already contracted and wish to become a participating provider with CCP, please complete the steps noted in our letter of interest available on our website at ccpcares.org. CCP agrees to broaden options for telemedicine by covering services when appropriate as a part of its quality program. CCP will cover remote patient monitoring, the collection and interpretation of physiologic data digitally stored and/or transmitted by the patient and/or caregiver to the qualified healthcare professional. Store and forward, the transmission of medical information to be reviewed at a later time by the physician or practitioner at the distant site. This means medical information will be transmitted electronically to a location for storage before it is sent to another doctor for review. CCP will monitor compliance by annual oversight audits, tracking and monitoring provider and member complaints. Any findings will be reported to CCP's Quality Improvement Committee. Additional provider education and resources on telemedicine are available via the following links: the Agency for Healthcare Administration website, the Community Care Plan web portal Provider Academy. CCP's Telemedicine Services Attestation Request Form is available on the CCP website. Should you have any questions regarding this presentation or need any additional assistance, please contact your Provider Operations representative or the Provider Operations Hotline at 855-819-9506. This concludes the Community Care Plan Provider webinar on telemedicine.